Ladies and gentlemen, I did not leave the gentlemen out. Screening for breast cancer is very important. As long as you do have breast tissue, that means a man or a lady, you can get breast cancer. Hello and welcome again into my bed. This is Dr. K and we discuss everything sexual and reproductive health. Hakuna kuficha. This is the place in the bedroom where we discuss everything. And this time I want us to discuss about those important tests or those important screening that you cannot miss in your life as a woman, because you'll be able to prevent some of these debilitating diseases we have in the country that kill women, especially cancers and some of these sexually transmitted infections. And you'll ask me, why is it important for me to go for screening when I feel okay, when I don't, So those questions are there. Everybody is worried, it's understandable that someone can be worried about going to the hospital because maybe you find something, but that is why we need to do this screening, because we need to find that something before it starts manifesting in your body. Because some of these things, if we catch them early, we can be able to prevent things like cervical cancer, breast cancer, and very, very adverse symptoms in your body. So don't be afraid to do this test. So one of the first ones that I really need to talk about is that one for cervical cancer. Why I'm talking about this is because as an obs and gyn resident, I really do see very, very sick patients who are going through cervical cancer in their last stages. So cervical cancer should be screened in all women who are above 21 years of age. Yes, I said it, 21 years of age. Why? Because most of us, by the time we're 21 years of age, you've already had your first sexual debut. So every woman who is actively having intercourse should have their first pap smear if they've never had a pap smear before. So what we usually do, we have several screening tests. As I've mentioned, pap smear is one of them. We do have the HPV DNA test, which is a viral test. It will tell you whether you have the HPV virus or you do not have the HPV virus. This virus is the one that causes cervical cancer in women, and it also causes other cancers in other parts of the body like the anus, and also in men as well, especially the throat area. So you'll find anyone who has cancer in those areas, it could be because of the HPV virus. So we test for that HPV virus at the cervix. We check for your pap smear also, and of course, if you have any symptomatology that can tell us or guide us towards having an issue with your cervix. Those are the very important things that we need to do. We've said it's important to have it at when you're 21 years of age. And then every 2 to 3 years, you're having a repeat pap smear for every woman as long as you're below 45 years of age. So if you know you had your last one 5 years ago, you're due for another one as soon as possible. Same for the HPV DNA test. It can be done. If you found positive, then there are ways to deal with it. If it's negative, you can also have the vaccine given to you. Another test that we need to screen you for is here, your breasts. Ladies and gentlemen, I did not leave the gentlemen out. Screening for breast cancer is very important. As long as you do have breast tissue, that means a man or a lady, you can get breast cancer, especially in the if you have a family history of breast cancer, it's important to do a breast screening. So the first thing you need to do is the home screening, and the one you can do it in the hospital. So for women, how to check for your breast, you need to do a regular breast examination on yourself, and this can be done at least every month, not during your periods, but somewhere close to your ovulation, you can be able to do a breast examination. It's very easy. All you need to do, you need a mirror in front of you. Watch yourself as you're doing this. You can look at both. You must be naked at that time. You need to look at your breasts, see whether they are the same level, especially the nipples, whether they look the same, whether they're different. Different sizes does not mean necessarily an issue with you, but it should not be pronounced, like this is extremely huge and then this one is very small. The other thing you need to do, as you do that, you can place your hand over your back of your head and then try and examine your breast. Divide it into 4 parts. You can draw a line across the nipple, but vertical, and another one horizontal. Then examine each part, each quadrant. They're called quadrants. Examine, and as you're examining, you're checking to feel whether there are any lumps, any abnormality, any hardness, and don't forget this part, the axilla part. It's called the axilla, under your armpit, because part of the breast goes to your armpit. In hospital, a way to examine, your doctor can examine your breasts for you if you're not comfortable with your findings. And then if they find any issue with your breast, maybe it's a lump that's painless or whatever it is, then they can send you to do an ultrasound of the breast as long as you're below 35 years of age. But if you're above 35 years of age, you're going to have a mammogram done for you. It's a way to screen for breast cancer. Another very important screening that you cannot miss at all, as long as you're sexually active, you need to remember that if you're having sex, there's a chance that you can get an infection through this sex. And it's called a sexually transmitted infections. They're very common, very, very common. Some of them, don't know whether they're there. Sometimes you can see it. Some of them are pronounced. So but they're very important for you to know that even if you do not feel anything, it's important to screen. That's why we have screening tests. We need to screen for things like HIV, very important. Herpes can be screened as well. We said HPV is also one of the sexually transmitted infections, can be tested. You also need to be tested for syphilis. There are things like chlamydia, gonorrhea, and there are myriads. STI screening is important, especially if you know you've changed your partners severally, or even if you're getting into a new relationship. I tell you guys, Nairobi, wherever, Nakuru, Mombasa, just get that STI screening done. You will be happy if you find something and it's treated. Don't be afraid to go because you believe that something will be found. If it's found, that is why that screening is there, and it might just save your life. So join me again on my next episode where I discuss several other things with you, and I hope you really, really enjoy this. It's here in my bed. We talk about everything.